Welcome to The Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone, and welcome back to The Hair Loss Show. My name is Dr. Vikram Jayaprakash.
And I'm Dr. Russell Knudsen. Welcome.
Hey, good to have everyone here. Thanks again for watching. Please remember to like and subscribe to the channel, and also please keep your questions coming. We really love to get your feedback on what you're liking and what you want to hear more of on the channel in future episodes.
So today I want to talk about a problem that we see sometimes in our practice, predominantly in women, which is kind of interesting, where they come in complaining of a long-term increase in shedding. So what I want to try and break this down to you can call it a chronic molt if you like. The technical term for it is chronic telogen effluvium. It's a well-recognised condition. So acute means lasting less than 6 months. Chronic means lasting more than 12 months. And there's many causes of acute molts. You know, fever, pregnancy, drug therapy, sudden weight loss, surgery. There's any number of them that can cause increase in shedding for a short period of time.
And they all fall under the banner of stress.
Yes, well, stress, well, actually acute stress is a cause.
Yes.
Because the stressor hormones do shorten the growth phase of the hair cycle and therefore increase the shedding. But I would remind people that shedding and hair loss are not the same thing. That shedding is a normal process. Every hair on the head has to fall out according to your genes. It can be anything from 2 to 6 years, the growth cycle on the scalp, and that will determine what the normal rate of shedding is. But the way to think about it, I think, is to think of it as a clock. All right, you know, so if we just draw a conventional clock, basically you should see shedding as the growth goes around the clock like this for a certain period of time, and when it gets to the end here again, the hair is shed. Okay, and so your genes control how quickly the clock moves, as distinct from a conventional clock.
So, for example, and I'm making a generalized statement here, women would have a longer cycle around the clock, hence why women can grow their hair longer. Men have a shorter.
Well, some men. I mean, the world record for hair growth is an Indian man, 26 feet and 4 inches. Right. Which would take about 60 years to get to that length. So he didn't cut his hair for 60 years. So think of it as a clock. So things can accelerate the clock. So there is seasonal changes, but these are in the acute, you know, short things. But there is this peculiar condition where predominantly women come in and complain of increased shedding that goes on and on and on. And the really interesting thing about it is they shed their long hairs. Now, long hairs by definition are healthy hairs, right? Unhealthy hairs do not grow long. So if you're shedding long hairs, you're shedding healthy hairs. But it doesn't mean there's a disease process going on, because if the clock sped up, the shedding rate would increase, but the hair would still be growing back 3 months after it shed. And that's the interesting finding. We don't see thinning in these patients, right? We just see this sudden increase, and it's a mysterious thing because it comes out of the blue with not necessarily a trigger cause that we can identify. It lasts for 2, 3, 4, 5 years or whatever, and then it can suddenly stop. And so what I wonder is whether there's some inflammatory trigger that set it off, and that it just keeps going, and then somehow spontaneously the inflammatory trigger settles down. And the reason I say that is because often when people go through accelerated shedding, they express symptoms of inflammations. They talk about tenderness, burning, itch, right, or flaking, which are all inflammatory symptoms or signs. So I think this is an important thing to understand, that it may be just an inflammatory process. So one of the things we try to do in these patients is see if we can settle some inflammatory reactivity down in the scalp with anti-inflammatory shampoos. Right? There are a lot of claims about therapeutic effects from shampoos in the marketplace which don't stack up, but there are proven remedies that exist within pharmacies, usually. So we have things that have zinc pyrithione in them, for example, which is Head and Shoulders. We have things that have selenium in them, which is Cellsun. We have things which have a antifungal ketoconazole in them, which is and often there's Nizoral around the world. These are all proven remedies for inflammatory conditions of the scalp. So you can have psoriasis of the scalp, you can have ordinary dandruff of the scalp, you can have seborrheic dermatitis of the scalp. These are all inflammatory conditions of the scalp. They can come out of nowhere. We don't really know why they happen. They can become chronic. They can affect part of the scalp or all of the scalp. It's really quite curious how this occurs. But I do think that this condition of chronic molting worries the women that come to see me about it really incredibly, and some of them really are symptomatically suffering as well.
Yes.
And so we try very hard. I mean, you can get to a shampoo that actually has cortisone in it too, like a corticosteroid. And so these are things that you can do, but that's what we're talking about here. It's not a hair loss per se. It's just a speeding up of the clock. So it's a mystery condition. Don't know necessarily why it starts. Don't know necessarily why it finishes.
Sure.
But it's not damaging.
That's right. And you know, look, hair loss for anyone is a stressful, you know, condition, and that could be a self-perpetuating thing as well, because the act of losing hair can also increase the psychological stress, which can also make
negative feedback loop.
Correct, can make it even worse. So the point being that the telogen effluvium, or T, will shed longer hairs, and essentially speeding up the clock. That's fine for the first cycle, but the second cycle, the second pass of the clock around the hand of around the clock, the next cycle of hairs to be lost. Okay, yes, it could be other hairs that will be shed from other aspects of the scalp, but what if you're losing shorter hairs?
Well, that would be unusual. So, for example, when people say...
But you're speeding up the clock.
I understand that. But if you can grow your hair to here, right, you've got a 4-year cycle.
Yeah.
Okay. So, you know, yes, ordinarily it would take you 4 years to lose every hair on your head.
Yeah.
Let's say the clock sped up twice. It would still take 2 years for that to happen, and it may have stopped in that time. Right? So we don't actually see... I haven't ever seen a patient come to me that has cycled on so long with this condition that they've come back reporting shorter hair.
Right.
Okay, but the thing I want to emphasise to our female listeners is that one of the common things that patients always say to me is, look, my ponytail is only half what it was before. And I remind them that if you go through either an acute or a chronic molt, the hair will only come back 3 months later, and it will only grow at a centimetre per month, and it'll take them 18 months to get long enough to be collected into the ponytail. Yeah. So nothing is going to happen overnight in terms of that. If you want to see that volume back in your ponytail or the volume back in the lower part of your scalp, it's going to take years.
All right. So taking it a step back from an individual's perspective, they're losing long hair. All right. Obviously, you need to look at what's the potential cause. That needs to be investigated. If it's something obvious, then yes, that needs to be treated, and you need to treat the underlying cause of that. But from your side of things, Russell, what are the top 3 things that you've found in your practice that are going to be beneficial? And I just want to highlight again that this is not meant to be as, take this information and go buy this over the counter. You need to be assessed properly and make sure that you've got the diagnosis correct.
First thing I tell them is to wash their hair regularly.
Yeah, because most people...
Because the first thing they do is they're scared to wash their hair, so they put a bigger interval between washes, which means even more hair comes out in the wash, because I'll remind people at the end of the growth cycle, the hair separates from the skin, it sits there, waits for something to tug it out, which is washing or brushing. So the less you do it, the more you're going to find. So the first thing I do is get them to do it. And there's 2 reasons I do it. Number one is to stop that artificial increase in shedding that they're seeing, which really isn't an increase in shedding at all. And secondly, if they're symptomatically complaining of inflammatory symptoms, washing more regularly the scalp and shampooing the scalp more regularly settles those symptoms down. Yeah. So it has a therapeutic benefit to actually wash it more regularly. And so I think that's the main message I'd get across to our audience, is that you should wash more frequently, not less frequently. It'll help symptomatically and also calm you down, that the hair loss is manageable.
That's the bit that is counterintuitive to a lot of people, because they feel that the act of, as you said, the act of washing or combing
is causing
the hair loss.
So that's the main thing.
That's the main thing. Perfect. All right, so I think that's something, chronic molting is something that we're seeing a lot of, all right? It can be very perturbing to people that are experiencing it. So again, I think the take-home message there, if there is one, is to make sure that this, if you are experiencing this, make sure that this is assessed properly and that you're getting good advice on how to manage that.
Yes. I mean, this is not something for your hairdresser to address. This is something for a medical opinion.
Yes, absolutely. Very good. Well, thanks again. Hope you found that useful. Again, please remember to like and subscribe to the channel, and we'll see you again on the next episode.
Thanks, guys and ladies.